All right, y'all, we made it. We made it to the end of our sustainability talks. This is going to be our last session for Texas A&M University's Virtual Earth Month. We are ending it on a really great note. I think this is going to be a really important presentation for y'all to watch. So with us today is Kendall Sitzmann. She is an environmental geosciences major, class of 2021, and she is going to be talking to us, looking at what other countries have been doing with their coronavirus responses and kind of comparing that and just seeing what decisions were made, when decisions were made, and how that has impacted the way that coronavirus has unfolded in different countries around the world. So I think it's a really timely, important topic. We can learn a lot from it, and really excited to share this with you for our last event for Virtual Earth Month. And for everyone that's joined us throughout this whole thing, thanks so much. We really appreciated your support. And just a couple small pieces of information, throw some questions in the chat during the course of Kendall's presentation. The more questions we have, the better the presentation's, going to be more exciting Q&A at the end. So please throw some questions in the chat and I'll ask all of those at the end. And also, if you are seeing the green bar on the top, you'll see my name where it says it's sharing the screen right now. To the right of that, there's a couple of dots. If you click on those, you go and you put it in side-by-side mode, it's going to be the best way to view this presentation. So with that, I'm going to pass it over to Kendall, and she's going to get us going for our last event for Virtual Earth Month. So Kendall, whenever you're ready, take it away.
Okay, hello everyone. My name is Kendall Sitzmann, and I'm a sustainability intern here at Texas A&M. And today I thought we could compare the countries and see whose preventative measures really are holding up the best against the coronavirus. So first, I wanted to start with just some background. So the first case of coronavirus was discovered in December 2019 in China, and the R0 value was initially 2.5. And what that means if you test positive for the coronavirus, you're likely to spread it to on average 2.5 people. And while that was what the CDC initially estimated, they've now updated it to be about 5.7. So for reference, the R0 for Ebola is actually 2, and the R0 for measles is actually 18, meaning it's very contagious. So as of April 27th, the world actually surpassed 3 million cases, and the highest number of confirmed cases and casualties is in the United States. So next, if I can bring your attention to this graphic, I wanted to discuss how this pandemic is living up compared to others. So look down here at the bottom, this is coronavirus, and this was updated April 28th. So it's pretty accurate. And actually throughout researching for my presentation, I've had to update this graphic a few times because it started out right in between yellow fever and Ebola, and it's continued to grow over the past few weeks. So it may look like coronavirus isn't very serious, being that it's down all the way at the bottom compared to some of these other giant ones. However, the pandemics at the top, as you can see, took place all over 100 years ago, meaning that now we have a lot more modern medicine and a lot of better technology that should help us combat a pandemic a lot better. So the fact that it's even on this graphic is very telling. And next, I wanted to go over some of the international responses to coronavirus. So if you look over here, you can see some different nations, and at the top, just some of the different responses they had. For instance, travel restrictions, encouraging social distancing, closing restaurants and bars, offering widespread testing, and going into lockdown. So at the top, you can see Italy actually enacted all of these, which is great because as we all know, they were hit very hard by the coronavirus. And you can go down and see just some different countries and what they did, how they reacted. Here's the United States. And then towards the bottom, you can see some countries that didn't enact as much policy as others, for instance, Australia and Iran. However, I'm going to talk about Australia a little more later because although they only enacted travel restrictions, they did it at such a key point that they were able to mitigate the coronavirus very well. And this chart was actually updated March 17th. So while much of this could be changed now, I just thought it was important to see who actually acted the earliest. So for some more background, the World Health Organization actually declared coronavirus a pandemic on March 11th, 2020. And Australia, as I was talking about earlier, they enacted their emergency response February 27th, which is weeks before a lot of other places did. And then Italy went into lockdown March 8th, and the United States declared their national emergency March 11th. Okay, next I wanted to go into detail a little bit more about the United States. So the United States was definitely criticized for lacking a national response, and many governors definitely took their own route. Some of them, like California, for instance, went to lockdown. Others recommended their own social distancing, closing the non-essential businesses, and some counties have actually started requiring masks in public. For instance, Brazos County is one of those. And many of these states are planning to ease restrictions and get back to work in May 2020. Texas is one of these. They actually just released a two-phase plan to get not every business, but get a lot of non-essential businesses back open in May, starting May 1st. And I know Florida has the goal to do a similar plan, and so does New York. Although much could change, it's definitely important to see what they're doing now. And I updated these numbers actually yesterday, so they're fairly accurate. And out of a little over 3 million international confirmed cases, a little over 1 million of them are in the United States, and almost 50,000 are solely in Queens, New York. Okay, next I wanted to speak about Europe. So the first thing I'm going to do is show you a video of a graphic of the evolution of confirmed cases in Europe. And what I really want you to notice with this is the scale. So as you can see from the thumbnail, that bar is a little over half the scale, and it only represents 2 confirmed cases. So I just want you to see throughout the video how this changes. So as you can see, the bar that was representing 2 now actually represents close to 200,000. And it may seem as though these smaller countries are doing better at mitigating it. However, some of these small bars are now representing 2,000 cases, which for countries with such small populations is very scary. So Johns Hopkins University on their website, they note that new cases are down in Italy, likely due to their high restrictions we talked about earlier, Spain, France, and the Netherlands. However, new cases are up in the United Kingdom, Belgium, and Germany. Okay, next, I wanted to talk a little bit about China. So the first case was identified in December 2019, and they announced their lockdown about a month later, and it lasted 76 days. Masks were not required actually in China, but they were very common, as you can see from a lot of media pictures of it. And China suffers from a lot of air pollution, so it's not unlikely for their citizens to have masks anyways. And China actually claims to have passed its peak. However, officials and different media outlets are definitely worried about the potential of a second wave if they were to keep easing restrictions. And they currently have almost 84,000 current confirmed cases and are getting up to almost 79,000 recovered. Okay, next I wanted to discuss a little bit more about the social responses from the different countries. So that would be the stimulus packages. So I just have a few different countries listed on here that I thought we could talk about. And I'll also have the US dollar conversions just for ease of understanding. So first, Australia, their furlough employees are actually eligible to receive almost $1,000 every 2 weeks. Britain, they are covering 80% of their unemployed workers' salaries for up to a little over $3,000 a month. Canada is giving their employees about $1,500 each month for up to 4 months, and they actually just proposed a student stimulus package where they can receive 1,500 Canada dollars per month starting in May if it were to be approved. The Netherlands is giving their companies up to 90% of each of their workers' wages. And lastly, we have the United States, who are giving a one-time stimulus check of $1,200 to eligible taxpayers. I think we can all see how United States compares in the social aspect and make our own judgment from these numbers. Okay, next I wanted to conclude, and the most successful mitigation strategies definitely are lockdowns, masks, and social distancing. And some of these nations, like Australia that I talked about earlier, they still have not reached 10,000 confirmed cases. As of yesterday, they were just at about 6,000, which for a developed nation that has access to testing, that is very, very good on their part for mitigating. And although it may seem as though these developed nations are the ones who are not taking the coronavirus serious, who are booming in cases, we can't rule out the fact that periphery countries are also in need of supplies and also are in danger just because they lack testing. So while all of this information is currently only confirmed cases, it's hard to estimate how many cases there actually are when they have a lack of widespread testing available. Okay, China saw a decline in new cases per day relatively quickly, but they should keep restrictions to avoid a second wave. And I think we can all see that United States is definitely lacking in every response from the virus. And if I can bring your attention to the picture over here, this is an example in Thailand of them social distancing during the virus. And they all have masks on, they're sitting 6 feet apart. This is in a public place. And the next image I'm going to show you is an image in America, actually in Huntington Beach, California, just 5 days ago during a stay-at-home order. As you can see, they're definitely not social distancing. I don't see a mask in sight, and it doesn't look safe. And here are my citations. And does anyone have any questions?
All right, great. Thank you, Kendall. Very, very well done. I definitely learned a lot from your presentation. So I do have one question already in the chat to get us started. So when researching, did you uncover any information about the reasons behind the amount of testing or lack thereof being made available in the various countries?
Yes, so the reason that a lot of countries don't have access to widespread testing is due to their medical status in different hospitals. So for instance, areas that have much better healthcare and much better resources and money actually, sadly, have access to these tests just because they see an importance of giving the wealthier the access to the testing, and it's definitely a disproportionate effect.
Yeah, okay, definitely. And then here's another question I have for you. What are your thoughts on individual states beginning to reopen businesses, especially given the lack of action overall by the US?
My personal opinion on individual states beginning to reopen businesses is that I know when they reopen businesses, I will not partake in stepping outside and joining in on all of this. I don't think it's safe, and I don't think this decision was based off of health and the safety of the people. I think it was based off of economics. And I I just really wish that the United States overall could have one giant plan of we will all open, say July or something like that, rather than each state taking their own action and it being very seeming unfair for other areas. And I don't like the idea of it.
So thinking about others like how states like Texas are taking their like own actions and we don't have like a a plan for the whole nation.
Mhm.
What do you think anything might happen in those states where they are going to be reopening early? Is there anything that you kind of are expecting or maybe kind of worried about?
Yes, I'm expecting definitely a second wave for Texas. And I'm definitely hoping that there's not going to be a reaction we see like we saw in New York, where cases definitely peaked much above the rest of the nation. But if Texas were to reopen as soon as they're planning to, I wouldn't exclude the possibility of that.
Yeah, and then also that picture, you showed us two pictures in your conclusion that
Mhm,
I personally found really impactful. I mean, that was like, yeah, wow. So when we think about reopening businesses,
mhm,
like if there's a safe way to do it, it would probably look more like Thailand
mhm.
than that picture we saw in the US. Like, do you think that we're going to be able to reopen businesses and follow those kind of guidelines in the US? And if not, what do you think some of the barriers would be for us not being able to behave in that same way?
I think one of the biggest barriers is just the culture in the United States is not taking it seriously. As you can see from that last picture I showed, not even were they wearing masks until the beach, not even were they social distancing between groups. None of that was exemplified. So I think that's very scary. And I just wish that the United States could have a little backing. And maybe if there was an authoritative figure who also took it seriously and emphasized that to the people, then the people would react differently. However, that's not the case.
Yeah, I think that that's definitely a really valuable and good point. So that's why I think it's really important for if we are able to stay home and social distance that we definitely should.
Mhm.
Um, I guess the other thing I was wondering is, like, can you kind of like if you're just kind of watch like the news, you probably haven't heard a whole lot about what other countries have done or the successful measures that they've taken.
Mhm.
Um, so I guess just thinking about that, like how important was it for you? Like, how did you like thinking about looking at other countries? Did that like kind of help you, get a better understanding of this virus and kind of the impacts and maybe like the actions we've taken and maybe the ones we should take?
Yes, definitely after researching, it put into perspective how the United States is living up. And a lot of the other countries that are having success, early success at least, like South Korea and Singapore, Australia, they enacted everything very early, as early as possible, even just restricting travel, limited the amount of spread that the virus was able to get. And I just wish that other places went into lockdown sooner and cultures took it serious. And that's really just the biggest impact. It's power in numbers. So social distancing and masks are definitely encouraged.
Yeah, and this was just some numbers that I just saw. So I know you had really current numbers,
Mhm,
but so the United States and South Korea, they had cases on the same day. The
mhm.
first case was on the same day, the first confirmed case. Yesterday in the US, there was 28,429 new cases.
Oh, wow.
In South Korea, there was 0 new cases. So it's not really a question, but I just thought it was really relevant to
That's
everything that you
definitely
had
something to think.
shown us and how much of an impact the decisions that our leadership has made that has really impacted.
Exactly.
All right, and we have one other question here. So do you have any suggestions about how we can encourage our state representatives to take the virus more seriously?
I think power in numbers is very essential. It's very easy for us to contact our state representatives. If you have the time, send them an email, send them any information you have, just saying how your safety is at risk, and that's what should be prioritized. And I think the more letters, the more numbers they get, petitions, they would be more likely to take it seriously.
Yeah, I think that's great advice. And I think also at the local level, and then I think just like the personal actions we take too is,
Definitely.
if we believe in wearing masks, then we shouldn't be wearing masks around in public and encouraging those people around us as well.
I think it's setting an example when you leave your house in a mask that other people are seeing you, prioritizing your health and the importance of this virus.
And I guess one last question I wanted to ask is, I didn't realize that we had issued a mask guideline in Brazos County.
Yes.
Could you say a little bit more about that, or what is that? Is that like just like a recommendation, or is that?
No, I know you can get fined if you leave your home without a mask. I don't know how serious the local level authorities are taking that, but I know in Brazos County, if you don't have some sort of PPE, a face protection mask, it can be a bandana, it can be a serious N95, anything like that, you can get fined. And that's in Brazos County. That's also in my home county in Fort Bend. That's when I first saw it and I was really shocked that they implemented something like that.
Do you know when that went into effect in Brazos?
Uh, I want to say maybe a week ago.
Okay, great. So not only is it smart to wear a mask for your safety and everyone else's, it's also kind of the rule right now.
You
So
can get fined, yes, a citation.
okay, great, great. All right, it looks like that's probably the end of the questions. So yeah, yeah, that was very insightful. Thank you. Amazing job, Kendall. I appreciated how current all your data was too. I agree. Definitely appreciate it because I know you made this earlier, but you continue to update the data even right before the presentation. So I think that was really beneficial.
Thank you.
But just yeah, overall great job, Kendall. And for all of our audience who've tuned in with us, thanks so much for your time, for your attention. We're getting some claps in the chat for you, Kendall. But we really appreciate you. Great job in the chat. But we really appreciate all of our audience members and thanks for following along with us and have like as we've sat here and discussed coronavirus connected it to sustainability. I hope you've kind of seen just how all of these issues that we look at in sustainability, they've all been really accelerated by the coronavirus, and hopefully the urgency that we are addressing coronavirus and hopefully we can have that same urgency towards the issues, the sustainability issues that we're looking at every day, especially like the big issues that are going to impact all of us like climate change. So hopefully you can see just how important it is for us to live more sustainably, and how if we implemented more sustainable solutions, we would have a better handle on this coronavirus as well. So really, sustainability is beneficial for all of us. It's just the way to make our world better. So hopefully you've been able to see that through these talks. And just so y'all are aware, we will have all of these talks. They've been recorded. I'll get them up on YouTube, and we will post links on the Virtual Earth Month webpage, so you can go back and watch these or look at them, or any of the resources that she saw if you want to check those out. Or please share them with your friends. I think the more people that see this, the better. And then I'll just end it again with learned a lot. Awesome job. Nice work, Kendall. Great job, Kendall. So I think that's the way to go out. So thanks everyone for tuning in. Stay safe, wear your mask, protect each other, and stay sustainable. Thanks, and gig 'em.
Thank you.